So we might actually get started. It's a couple minutes past 2. And there's 29 attendees online in addition to the panelists. So I think we've done pretty well on this Thursday, the 21st of May, for the very first ACS webinar. And I think it's timely that this webinar is all about the response to the COVID epidemic, and particularly how SRLs are trying to deal with an unprecedented amount of change and uncertainty in what we're facing now. So thanks to all the attendees and thanks to all the panelists for giving up their time. And it was really lovely to see when we sent this invitation out that there was numerous responses from all around the world, from New York to China to various parts in the EU, all responding positively towards this, and just showing us how important it is for a real discussion to occur around how SRLs are trying to deal with, like I said, a really unprecedented time and a really uncertain time in how we try to keep the business flowing and how we try to keep the science going. And so everyone here is in some way related to an SRL, so I think it's really important for us to have this open, honest discussion. And it really is a discussion. You have 6 really well-known SRL managers on the panel today, in addition to myself and Helen. But of course, we want this to be interactive. So you can totally ask any question you want at any point, and Helen and myself will try to pass that on to the panelists. So as we run through this episode 1, running a shared resource laboratory in the time of COVID, we took on board some of your suggestions, so we hope we've answered that, at least some of the questions that you put into the form. And we also had quite a number of discussions among the panelists to see what we thought was important. So we're going to jump into that pretty soon, but first of all, let me just tell you a little bit about the Australasian Cytometry Society, why we exist, and what we try to do as a society in order to give back to our members. So we were established in 1979, just a group of a few interested people looking at integrating with cytometry, and it's grown since then to be quite a major cytometry space in Australasia and indeed the world. So our mission is pretty simple. It's scientific and educational organization whose purpose is to promote research, development, and applications in and to disseminate knowledge of cytometry. And so when we think about cytometry, we are dealing with flow cytometry, which is bread and butter for everyone here, mass cytometry, which a few of the panelists and a few of you I know are engaging in, genomic cytometry, which is really a emerging trend around the world. And of course, imaging. We shouldn't forget imaging. And Adrian will never let us forget that. So that's good. There are a number of member benefits. We noticed that not everybody on this call is a member of ACS, and there might be various reasons for that, but the benefits are clear. The ACS and its members are developing regional clinical guidelines, and that will really help in the clinical flow space. There, of course, is discounts on ACS events. There are member-only events. This is not a member-only event, but webinars like this in the future may become that way. The ACS provides scholarships for its members and for affiliated activities. And I think the second last point there is really important. It's a society that allows you to network with your peers and industry leaders to gain experience that you wouldn't have in any other setting. Of course, we run annual conferences, workshops, and roadshows, and as a response to the shutdown and our inability to get into our workplaces, we're rolling out webinars like this as educational material as we try to struggle with what's currently occurring. You can, of course, connect with us through various ways. You can use our email address, contact@cytometry.org.au. You can hit us up on the web, cytometry.org.au. And of course, we are all social media beasts. So we have a Twitter and a LinkedIn presence. And if you wanted to create a conversation around this webinar going forward, then please do use the @ACS Cytometry Twitter handle. But today is all about running a shared resource in the time of COVID-19. And we're going to jump into that very shortly. But by way of background, your moderators are myself and Dr. Helen Maguire. I am the Industry and Innovation Liaison for the ACS, and Helen is the President-elect, and many of you will know her already in that role. Helen, of course, is also an expert immunologist, and we're just going to throw to her now to give us an immunologist perspective on COVID-19. Thanks, Helen.
Thanks, Rob. So, I mean, we're immersed in this concept, and this subject has taken over our lives, so we don't really need to, harp on about it. But really, what we know, or what we think we may know, is impacting how we run our SRL. So let's at least have a quick discussion. So it is an evolving field. We acknowledge this, of course, spreading around the world, and how this happens and how it may impact our health is being quite obvious. So the cells in which being infected are across your lungs and making it hard to breathe. And while we have obviously an orchestra of immune cells that are working hard to fight this infection, some people aren't certainly handling this very well, and we don't yet really understand why that is the case. And another area of absolute importance in research going on is whether you have lasting immunity, and that's certainly not a known quantity, and people would certainly suggest that it's not a known quantity at all. So there is ramifications for this. So if an immune response is not lasting, if your family members get sick, can they pass it on? All sorts of things like this. And it leaves us really at the beck and call of some very simple but useful tools, and that is hand hygiene and social or physical distancing as our best wall of defense against COVID. They're the tools that are working now, and they're things that we need to implement in our SRLs and our workforces going forward. So it is, of course, the aspect that we do need to talk about is the alarming aspect of the virus being able to be passed on, even though an individual may appear asymptomatic. So it's contentious why that is the case, or how that can come about, and certainly, again, another area of important research. And so I guess just as a final thought or aspect we need to consider is this idea that we are now in a world where we can rapidly contact trace. It is a brave world that we're into now. Whether these tools can be implemented to have work facilities, safe work facilities, we should be able to identify individuals who are carrying this virus rapidly, but certainly an evolving field and something we're here today to talk about. Thanks, Rob.
Thanks, Helen. And so now we're up to date with the immunological and the academic perspective of the disease and the pandemic. What we're really here today to do is to talk about the SRL and the SRL response and how your SRL can deal with this. And we've actually put together a really, what we think is a really good, mixed and balanced panel. And we have Dr. Adrian Smith from the CPC and the Centenary Institute. Adrian Smith here is channeling his inner hound. So, and he's waving to. We also have Kylie Price, Dr. Kylie Price, who's from the Malaghan Institute over in New Zealand. So a different perspective there from the Australasian side. We have Simon Monard, who many of you will know from the WEHI and from his escapades around the globe. We have Michael Thompson, who is from Monash and the Hudson Medical Research Institute. We have Eva Orlowski, Oliver now, sorry, changed the name, from the Burnet with a big PC3 sorting presence. And to round us off today, we have Dr. David Sester from Queensland. And so we'll ask all of our panelists for their views on a series of questions, and we will try to balance these so that we can get a complete picture for you. And of course, as I said earlier, please do interrupt through the Q&A function of Zoom, and we will try to pass your questions on. So with that, we just jump into the first question. And we all have been watching the news, and we've all seen that each individual state and each individual country and region's response to the COVID pandemic is different. Some places are completely shut down and some places aren't. Some places are taking a realistic, rational, scientific approach to this, and other places aren't. So with that, we might just jump to the first question, and we might ask for a unique perspective that's a little bit outside of Australia, and ask Kylie how her organisation has dealt with COVID-19.
So we went to quite a hard system. We went to alert level 4 on March the 25th, which was a complete shutdown for everybody who were non-essential services. So that meant that the Malaghan pretty much shut down, except we've got clinical trials, and we decided that the patients who are undergoing treatments on those clinical trials, that's still an essential service. So the scientists who were involved with that had letters to come in, and as an SRL, we had to support the scientists who were involved with those programs. And how we did that was we had one staff member, I asked one staff member to come in per week just to QC the instruments. We were all available. If anybody needed us, we could be contacted by phone or by Microsoft Teams. But I had one person coming in to QC the instruments and make sure that they were all running. We didn't sort during that time. Our sort operator did a great job of just getting through as many as we could before we went to alert level 4. And thankfully we didn't have any sorts during that time. Then on the 27th of April, we moved to alert level 3, which was that you were expected to work from home if possible. And so what we did there was I had one staff member rostered on per day. So we had some staff in at the Malaghan, but most of our staff still at home. And then, yeah, Thurs.
Thanks, Kylie. Yeah, so New Zealand obviously is a little bit different to Australia and dealt with this in a different manner. So we might just throw then to David Sester. Dave, your organisation is a little bit different. It's a mix of 3 different organisations. So maybe you can just talk us through how your institute approached this.
Yeah, thanks, Rob. So we have 3 major partners that use our shared resource laboratory here in terms of flow. Of them, when the situation started, one of them went to a pretty secure lockdown with only limited authorised staff, while the other 2 went to a situation where they had reduced staff on site, with them being authorised mainly for essential experiments. As we've moved through that, 2 weeks ago, the partner that went to complete shutdown has started to open up, and they've now got staff on site which are authorised to do critical experiments. In terms of our core, we've been operating with about 50% staffing on site and a slight reduction in what's available in terms of sorting services.
Thanks, Dave. Adrian, you run a big core as well. Do you have any different perspective?
Not particularly. A bit like David, we have a couple of stakeholders, being the University of Sydney and Centenary Institute, and the university core facilities went into a fairly uniformly described safe mode, where staff were primarily at home. Only experienced users were allowed on the equipment, so all new or inexperienced users were not able to use the equipment. But we kept working. We still had quite a few people, quite a few of our experienced users continuing. Sorting continued at a decreased level, so we did change.
My connection dropped out, or your connection dropped out there for a little bit. So
yeah, sorry about that. I should be back now.
Yes.
Yeah. Okay. So we stopped. We did sorting decreased quite considerably, but we've still been sorting through the whole time, and our sorter operators have been on a rotating schedule to come and do that. And we did a lot of things to reduce the number of people in the facility. We grouped instruments together for booking so that only one could be booked at a time. All the bookings have to be approved before the person's allowed to use the instrument, and you can't actually log into the instrument until you've made a booking. So those sort of arrangements.
Yeah. All right. That's a good perspective. Now, Eva, you run PC3 facility routinely, so this may not have been all that new, or at least the approach to handling these samples may not have been all that new. So do you have anything that you'd like to add?
Well, we haven't actually had any requests for the PC3 facility as yet to run these particular samples. But when we do, we will be prepared to use them and to run them through the PC3 facility. So that is a benefit. But in regards to operations and shutdowns, we're actually, excuse me, quite similar to David. We have 3 major institutes that we look after as well that utilise the facility, and each of them had different levels of lockdown. So we had to try and manage all ends, try to keep everyone happy and safe, of course. And we pretty much just continued sorting, but stayed at home when we could. So we had a roster system as well for all our staff members, and just had minimal staff and consolidated sorts onto 1 or 2 instruments so that we didn't have as many staff coming in as possible.
Yeah, that's great. So it sounds like everybody has reduced their hours and their interactions with users, and I guess this is probably expected because the users themselves have been asked to, in a lot of cases, to not come in unless it's critical. So I guess that brings us to the next question. In terms of the laboratory setup, are you reconfiguring your labs to allow for this social distancing, and how are you doing it? And so, Simon, undoubtedly the biggest SRL in Australia, how are you dealing with this? It sounds like a nightmare from your perspective.
Sorry, just unmuting. So we've spread our machines out as much as we possibly can. We've got lots of bits of yellow tape all over the floor so that people can sit the required 1.5 meters apart. And I think anyone who's been in my lab, they all laugh at me for having a bunch of old antiquated machines. So I thought it was actually a good time to probably get rid of some of the old stuff and consolidate the usage onto the newer machines. So we've actually got 4 cell sorters online now. We did have 3, and we can run those 4 with the operators and the investigators suitably separated from one another. And we're back. We normally have about 12 analyzers. I think we've got about 10 analyzers back online. We'll probably get 1 more sorter back online soon, but we'll have to move it out of one of the rooms it's in and put it somewhere else so it's suitably distanced. So but mostly physically moving things apart from each other. Our lab is fairly spacious. We're quite lucky in that respect, I guess.
Yeah, so that's that's really interesting. Mike, you're probably on the other side of that with a smaller lab. What was your experience?
Our experience was, we were fortunate that in terms of the social distancing, that our instruments were already about 1.5 to 2 meters apart. What we did have to enforce was 1 person per instrument. So yeah, we didn't have to move any instrument around. We just made sure that all users knew, with plenty of signage and emails from me, and also me constantly walking through the lab reminding people that 1 person per instrument. We ended up putting a little station at the front door which had additional gloves and ethanol to remind people to have the correct PPE before entering the lab. So that worked fairly well for the analyzers. For the sorting, what we did was, if people were able to and confident enough, we let them come and set up their own gating strategies or use the sorter, or if not, try and give us a indication of what their gating strategy would be, and we would set it up and get approval. So it's kind of a little bit of a confined space. There was lots of screenshotting and emailing back and forth, but for the most part, it worked fairly well.
That's good to hear. Good to hear. Dave, last time I was in your lab, it was an open shared space amongst your sorters and your analyzers. Was this a challenge for you? You're on mute.
In terms of analyzers, the facility itself, we put clear signage in terms of a number of people who can be in there at any one time, in terms of the 4 metre squared rule. We have put signs enforcing 1.5 metre distancing. We've also, like Simon, put markings on the floor next to instruments, and we've also moved some of our more heavily used instruments around to separate them out a little more. In terms of sorting, we have staggered sort starts, and when the person arrives, they notify us. When we have time to bring them into that the sorting area, the sorters aren't in separate rooms, but they are clustered in a smallish area. We will set up the sort, make sure that they're happy with it, and then we'll ask them to leave until the completion of the sort. So that has been challenging, but we've just managed it with staggered starts, and obviously the workload hasn't been as high as in normal times.
Yeah, okay. That's good. We actually have a question from Harpreet here, asking, in addition to the social distancing, are you encouraging people to wear masks while they're in the facility? So I open that to the panel.
We are. We've got one set of instruments in one room that are less than 1 metre apart. So our guidelines say that the instruments need to be 1 metre apart. And the cell sorter and an analyzer in the same room. So if those two people want to use them at the same time, we've asked them under alert level 2 to wear masks. At alert level 3, they weren't allowed in the same room. So the occupancy rates of the room are changing. But where people, if a trainer needs to come in, if one of the core facility staff need to come in and help somebody, then we ask people to wear masks, and we've provided those for everybody.
What sort of masks, Kylie?
I don't actually, just standard masks that came in a pack of 50.
Just surgical masks.
Surgical masks, yeah. But they're not anything super special.
Okay, I think there was a lot of discussion in the general populace about what a mask is and how effective they are and all those kind of things. So, certainly there are different classes of masks, and if it's hard for people that work in the labs to understand what they are and to get their heads around that, and then it's no surprise that the general public had a large difficulty with this as well. So on the same sort of question, there was a question from an anonymous attendee, apologies, whoever that was, about using external monitors, like things like TeamViewer and those kind of things, to help with social distancing.
Yeah, that's certainly something that we've been doing, and so we've had a camera set up, a camera and webcam set up, connected to the sorter, but then shared the screen of the sorter shared with the researchers. So they'll come and drop the samples off in the outside room. The operator will come out and pick up the sample, take it in, set it up normally, and then start showing them, sharing the screen with them remotely, and setting the gates up collaboratively as they normally do. I think they have to zoom in a bit to get the detail that they need, but then they can also chat and talk to the person and see what the sorter's up to. And I think some people like it enough that we'll probably leave that going after we get back to a more normal situation.
Yeah. On that, Adrian, there's a question from Kathy who wants to know whether you're charging people for the additional time that takes.
Yeah, well, the time starts from when they operate the the operator starts setting the sorter up. So I think, yes, we probably are charging them a bit extra because it will be a bit slower. But it doesn't take all that much extra time compared to, someone sitting there and arguing about the gates anyway. Yeah, I'm just having some background messages from my staff who are actually doing it, saying, no, it doesn't take them much longer. So they're probably not spending that much more time. I think when we get further down and we start talking about finances, we're in the situation where direct cost recovery is not a critical metric for us. Obviously, the stakeholders like us to recover as much from the researchers as possible, but that's certainly not their primary driver. They want us to facilitate research. So we would not be under pressure to charge extra, and we would certainly be open to if it turns out that we are having to spend a lot more time, to not minimizing the additional cost on the researchers as far as possible. I mean, that's going to be a give and take between the institute and the researchers and us. So it'll be an ongoing discussion.
Yeah, yes, definitely. I feel like a lot of this is an ongoing discussion with users and stakeholders in the cause. Before we move on to our next question about managing bookings and training users, do any of the panelists have anything else to add to reconfiguring the lab?
We've been a little bit lucky, probably the one and only time where a non-co-localized flow lab is actually beneficial. So a lot of our instruments are spread between the 3 different institutes that we service. So a lot of the instruments, there is only one in each room. So we've been pretty lucky in that way.
And I'd just add that, like Michael, we've had to keep an eye on the room occupancy rates. So if somebody wants to pop in and see someone or ask something, we need to really keep an eye, because we've got 1 user per cytometer, but we need to make sure that people aren't just dropping in to say something, and also that they're booking the instruments for themselves for contact tracing.
That's a good point. Yeah. All right. Thanks. All right. In the interest of time, we could talk about this all day, but we're just going to move on to the next question. And I noticed that some of the questions in the Q&A panel are in some way related to this, and how we're managing bookings and training users. In the reduced hours that we're all running, do we actually have capacity to do everything that we're being asked to do and things like that? And so we'll direct this question to Adrian in the start.
Do we have enough time? At the moment, probably, but I can see as things ramp up and people come back to operating, the restrictions are going to, people are going to hit some barriers that they wouldn't have had there before. At the moment, for example, we're talking about bookings. We've grouped 2 of our heavily used analyzers together as one item within our booking system, so that only one can be booked at a time because they are so close together. So we are actually physically looking at how we can move some instruments between buildings to spread those apart and increase that capacity on the analyzers. And we're certainly going to be constrained for cell sorters, but probably not that much more than we already are. We're already constrained by staff availability as it is.
Yeah. And Simon, your perspective on this, being large, generally busy core?
We're able to accommodate everyone. So as I say, we've got 4 sorters online at the moment which are available, but at the moment probably 3 of them are booked every day. So we've still got some capacity in hand. And same with the analyzers, so we can take whatever they throw at us. We'll just roster more people on. So my staff are considered essential workers, so we're allowed to have as many of us in there as we want. We even get special car parking spaces, which is rather nice. So the people in the research laboratories are only allowed a limited number of people, so they can't, we can keep up with them pretty easily at the moment. That's not really an issue.
That's great to hear. And Kylie?
Yeah, we're fine. Everyone can come in and use our cytometers at the alert level we're at, and they are. So things are going well. I'd say for user training, what we've done with our Auroras, they came with the Microsoft Teams already on, on the computer, and we've just been trialing that out, training people, which is really good. So you can train people remotely at their desk how to use the cytometers. And then we've just got 3 supplementary videos of somebody, like showing the setup, making sure that the waste is empty and the sheath is full, someone putting a tube on the SIP, and then once you're finished, so at the right stage, you just show those 3 videos, and then we can do all of our training that way. And we're just looking at getting the same on our BD cytometers. So I was talking with BD and they said, just back up your C drive before you try it and see how you go. So we're going to do that, and because that's probably the bottleneck for us, will be trying to train new users if you can only sort of do one-on-one with PPE. So we're hoping to do it all remotely.
Yeah. And Mike, I know that you had an interesting take on how you may approach this remote training.
Yeah, so our one has been a little bit different, where all of our honours students and a lot of our PhD students have not been coming in. So the request for training has really gone down because that's the bulk of our training use. So we were not allowed to do face-to-face training because of the social distance, which made things hard. So we've tried a little bit of a combination of some videos and a live webcam in the room. So in our situation, we've only had a couple of goes at this just because there hasn't been a great take up on it, but all of our instruments are actually unnetworked by the IT department here. So we've got one computer which is not on any instruments, which is on the network. So we set up Zoom and a high definition webcam on quite a long cord, and I was able to give someone a refresher training who came back from maternity leave and wanted a little bit of help. So we were able to go through that and just point to different parts of the instrument, which was a good way to do it because it was a semi-experienced user and we could go through what they remembered, what they needed a little bit reminding on. So it definitely helped iron out the kinks in it. Whether it's got long-term viability for training, blank slates, that's something we might have to look into, but it did help for, coming in without coming in to help for a little bit of training refreshing.
Yeah. Yep. Eva, we have Jezza on the line saying that you've stopped all of your one-on-one training. Can you walk us through that?
Yeah, definitely. Just due to the Institute's social distancing rules, we're not doing any one-on-one trainings, and we've actually stopped trainings altogether at the moment until it's safe to do so. So we've taken some steps towards, we've created a video actually running through an induction session, which we would usually do ourselves one-on-one with the trainees. Hopefully we can send that out. The users can re-watch this video over and over again until they're at least hopefully semi-familiar with the process, take their own notes. And then in the future, there's, once we're allowed to do one-on-one with extra PPE equipment or whatever the recommendations will be in the future, hopefully users will have a little bit more of a knowledge base, and it might be easier to do so using, I've heard of suggestions of using laser pointers and standing, the 1.5 meters away and going through it that way. We're just going to work it out as we go, but at the moment, we're not actually doing any trainings.
Yeah, I think that's interesting. I think there's a question here from Rob Stewart who's asking about how we assess competency in the training and whether we are how we're assessing that they're confident to go forward and use these instruments themselves, especially in these times when the labs are much more closed off and there's less people there to potentially provide some input on how they're doing their running their flow. So Dave, can you shed some thoughts on that for us?
Yeah, so we are returning now to doing trainings. We will be doing them one-on-one, but minimising interaction as much as possible. Obviously, it's pretty much impossible to do a training over 2 to 3 hours without having encroachment of that 1.5 metre rule. So we'll be using essentially risk mitigation for that. So we'll only be doing one training per trainer per day, one trainee per training session. And we'll also be mandating use of surgical masks during that training session. We did also consider face shields and N95 respirators, but because of the lack of or possible need for those respirators, if they're down the track, if there are any problems in terms of flare-ups, we've gone with surgical masks. Part of that is just trying to have a visual to people that this is not business as usual. This is an exception, because obviously general lab people will start to see people getting trained with close contact and think, oh, well, we can have close contact in the general lab space. So obviously that visual of having masks and that for training. The other thing we've put in place is an authorization process for training that needs to have a special form filled out for being critical requirement for training, and then that is passed on to the senior management of our partners for authorization. It's not until we get authorization back from our partners' senior management that we progress with the training.
Thanks, Dave. Does any of the panelists have anything else to add?
I'm doing pretty much the same as everyone else. So we're still doing one-on-one training, but keeping physical distancing. So it means chairs with wheels on help, don't they? So you can roll the user out of the way and you can go up to the screen every now and then if you need to. It's a bit crude, you know. So I can do screen sharing using Teams on. I can remote into all of the computers on all of the analyzers in my lab, actually. So I can show people from home how to do stuff. I can do a certain amount of training, but that's a bit clunky as well. So we're all learning, I guess, aren't we? We're all figuring out our best way of doing it.
We're assessing trying to assess some level of background competency through some quizzes that we've set up in Google Classroom, but also watching people after they've been given sort of novice level access, watching them as they set up and run the instrument more closely than we would have in the past. But that's something that we thought was necessary because people are just not around as much to help out if there's an issue, just so we need to keep a closer eye on people.
Yeah, we do a similar thing. We have, after the training session, the first time a novice user gets on, we do a one-on-one follow-up session. So that's done with distancing and PPE, but just trying to actually watch what the user's doing, because the first time, you know, theory is one thing and practical is another.
Yeah, we've actually been pretty lucky. Our education and training is pretty robust. So at the end of our trainings, we actually have a licensing test where the user actually has to demonstrate that they can do what they've been taught without our assistance. So, I mean, we're not too worried, luckily. Whoever we train should be trained.
Great, thanks everyone. Just a quick question before we move on to the next topic from Svetlana. Is anybody here not offering training and just simply doing it as a service for the analysis side of things?
I would love to have the capacity to do that.
Kylie, were you going to say something?
Sorry, I was leaving space. We're doing that for external users. We don't have many. We've done that for one external user. We ran the samples for them because they're the people that we're not allowing into the institute, or we haven't under level 4 or 3, but at level 2, which we're at now, they can come back. So we did run their samples, but that's slightly different.
I have a couple of external users as well who are handing over their samples in the lobby downstairs, and I'm going up and running them and sending them the data afterwards. But it's just a couple, so generally not. Okay,
so no sort of fundamental shifts towards a more sort of service for analysis. So that's interesting. Hopefully that answers Svetlana's question. All right, so with that, we might just move on to the next question. about staffing. You know, it's different for different size corps and things like that. But there's a lot of people without full employment, at least in the general public, and there's a lot of people without jobs. I don't think that this is the case for many people in the SRLs. I haven't heard of any large layoffs or anything like that. But maybe we'll just get a little bit of input from each of the panelists about this question. So, and we might start with Eva if we can.
Sure. Yeah, we are just trying to do our best. We've got all our employees at the moment either working from home or coming in. But yeah, there's been no major layoffs or any indications from the Institute, which is good, which is promising.
Yes, very promising. Yeah. And Kylie?
Yeah, no, we haven't had any layoffs, so everyone's been kept, and the way that we've tried to keep our staff busy, I'm just going to segue to that.
Yes.
So I guess the situation depended on whether you had children or not, because those with children working from home, it was obviously a lot more difficult without childcare. So as an SRL manager, I definitely tried to be fair to those people who had the extra pressure, myself included, of having children at home. But the things that we did do, like I got the team to do lots of webinars and training courses. Those of us who analyse data for our users were busier than ever because everyone was sitting at home with data that they should have analysed months ago and the time to do it. So we were helping support lots of data analysis, did a lot of planning for future modules. So if we want to do education modules, we were looking into what we might do, lectures and wet labs and things like that. And did like an antibody inventory and budget projections, and we kept ourselves pretty busy. And then just to stay in touch, because everyone was at home, our team did the quiz daily. You know, there's an online daily quiz, so we all zoomed in or did the Microsoft Teams and did the daily quiz and said what we were going to try and do professionally and personally each day. That got hard because personally it was like, I don't know, do the walk the other way around. I'm not sure, there's not much to do. So yeah, we were really busy, and we trialed lots of different software, that high dimensional software, well not lots, there aren't that many, but we trialed some high dimensional software packages as well.
Yeah, yeah. Simon, as you have a lot of staff, and I can imagine that this would be a complex problem for you, potentially. I think you're still on mute, Simon.
Sorry. Yeah, we had pretty much completely shut down on the 29th. That everyone was told to work from home if they can. Just a few essential people were allowed to come in that fed mice and that sort of thing. So yeah, so I have 7 staff and we all had to work at home. So that was quite a challenge to try and think of things to keep them busy and useful. Because we're obliged to actually work at home when we're at home. We're not just told, just go and take a few months off and laze around. You know, we have to actually do something. So my guys have been watching lots of webinars. The CytoU resources actually prove really useful. So we meet by Zoom twice on Monday and Wednesday mornings and Friday afternoons. Usually Friday afternoons we discuss a webinar. And the other 2 days, we discuss the other tasks that people have been doing. Like we've been updating our biosafety records and a whole bunch of other stuff, making databases and generally modernizing things. And lots of people are doing, just tidying up stuff and trying to do things better. So now we've got 4 people coming in. So most of the staff, half of them anyway, are working from home, the other half actually coming in. So it's getting a bit easier, but it was getting to be a struggle after a month of everyone staying at home.
Yes, definitely, definitely. And so Sydney is opening up a little bit more now, and apparently we're sending our kids back to school full time as of Monday. So Adrian, what's your take on what has happened, what you've done in the past with your staff, and what you're planning on doing with them and to engage them in the future?
We're, I think, been very, very busy anyway. There's been a lot to do. The staff have been sort of rotating, coming in and doing things like the QC in the morning if there's some analyzer bookings or if they've got a sort to do. We have a pretty significant problem in that we don't have an office desk or desks for all the staff at once. I've got 5 people crammed into a room, which really should only have 2 people in it, even in normal times, let alone when there's social distancing involved. So we'll be, I think for the next little while anyway, we'll be gradually coming onto site more as there's more research. But I think there'll be quite a lot of work from home for a while, still from here. And like Simon, we catch up regularly on Google Meet in our case. And we also have an extremely active discussion going on all the time, pretty much on Slack. Yeah, I'm just looking at the number of Slack messages that are going backwards and forwards right now as we're as on this webinar, which most of my staff are watching and making comments in the background. But yeah, that's how we're sort of staying in touch.
Yeah, I expected nothing less from you, Adrian, to use all of the latest communication software. We have a comment from Jezza here saying that their staff are expected to be 80% productive. And this seems to be a Burnet Institute guideline. So maybe we won't ask Eva to comment on this, or maybe we will, but we'll just put it out there to everybody. Does that seem at all reasonable in these times?
I would think not. I think 50% if you're lucky. If people are working from home, when people usually operate instruments and stuff, I don't know. I think it seems a little, their expectations are quite high.
Yeah, I would, if I was still managing a core, I'd certainly be worried about that.
I think it's a bit hard. The institute putting out an 80% rule like that is probably applicable to the other 95% of the employees, which exclude us 4 as a core facility, because as you said, it's quite hard to be 80% productive when we use instrumentation. No, most of our job is QCing instruments, cleaning them, training users, sorting. So it is difficult, but we damn well try. We definitely have been looking through all the CytoU webinars, updating SOPs. We've just generated a refresher course for all our users. Many little bits and pieces, redoing our syllabus, just lots of bits and pieces so that we can try and reach that 80%.
Great. If there's no other comments from any of the panelists, then we might move on to the next question, which of course is one that keeps many of us up at night. SRL finances, and really how big an issue is it for you? And perhaps the follow on from that, if it is a big issue, how are you being supported in managing that? So let's ask Simon about this one.
It is a bit of a worry. I mean, in April, our finances, I mean, we're 100% cost recovery, right? We recover all the costs necessary to pay the service contracts and all the stuff, the costs and stuff. So our income was 10% in April of what it usually is in April, so of the previous year. In May, it looks like we're going to be about 40% of the income. So there's going to be a shortfall at the end of the year, a massive shortfall. And I usually pride myself on how well I balance my budget. But it's not our fault, is it? So they're going to have to bail us out. They're going to have to bail out all these sort of facilities, I think, our institute. We are eligible and we have applied for and will receive the JobKeeper, which I think the money can be used to plug the gap a little bit. But it's going to cost WeHire a lot of money. So but that's not really our problem. I think I'm not expected to get rid of any of my staff, so I'm not really sure. So it's up to WeHi to just deal with it really at the end of the year.
Yeah. Kylie, you have a phenomenal ability to have philanthropic support for your facility. So is your experience any different or better off for that?
It's a little bit different. So the Malaghan is a publicly funded charity, so it's easier for us to tap into these philanthropic streams of funding. But what we've been hearing from some of them is that they often support the Institute through dividends and payouts from their bonds and shares and things. So obviously that's taken a real hit. The global financial situation's not a good one. So there will be a big reduction for some people, you know, who won't be able to pay us the dividends. A lot of them said they'll pay what they've said they'll pay to the end of the year. But on the other hand, we've been in the news a little bit because we're trying to get a national vaccine program off the ground, or we're one of 7 places that have come together and gone to the government for funding. And so the Malaghan brand's gotten a bit higher, and that's brought in other support from the community for people actually feeling like they want to donate their money towards trying to make a difference. So it's hard to say. Well, I guess we won't know for a while what it actually means, but on one hand it looks bad, and on the other hand it looks good. So I don't know.
Yeah. Yeah. All right. Thanks. In the interest of time, we might just ask Michael and then Dave if they can talk about this.
Yeah, sure. I was a little bit confident looking at my April numbers and then reading everyone else's or hearing some other people's responses. But when I actually looked at the numbers a little bit harder, we probably operated from the analyzer perspective at 2/3 usage and income is what we did prior to the shutdown. But I think a lot of that was people rushing in experiments before they were told to stay at home. So there was a big peak before a massive drop, and having a look at May, it really hasn't picked up. And our sorter hours have really diminished, I think from a combination of the stay at home, and also too that we have a few groups that rely on buffy coats and human samples, and because everything needs to be treated as potentially infectious, they can't get their hands on a lot of material, or they can't process a lot of material. So that has definitely dropped off. And the big issue for that for us is getting management to pay service contracts. And that is a real issue we're having at the moment, where they look at the numbers of what's coming in and the numbers that we're expected to pay to the vendors. And yeah, we're poles apart at the moment about how that's going to go forward. So I'm trying to frame it in a way that the instrumentation together, instead of looking at the individual income of the sorters and the analyzers, to look at it as one package and how they complement each other and complement the research. But it is a battle, and I'm sure it's not unique to me, where everyone's going to be having that battle with the people that pay the bills.
So similar to Michael, our downturn, we've been running at about 60 to 70% overall in terms of cost recovery for the laboratory. I think the major hit's been in sorting. Analysis has stayed probably a little bit higher than dropping really out. So at the moment, that's been 2 invoices that have been down. I suppose it really depends on the coming months how we can return, what the longer term effects on research projects will be. Obviously, there's been a huge stop on a lot of projects, and the time that will take for them to get up and running again may be more extended than what we think in terms of animal resources, provision of animals and that. So at the moment, we're probably going to reassess that in a little while and just see how the impact that we've had just recently in our facility over the full year budget, if it's a major one, which will need drastic cuts to how we look at service contracts and stuff like that, I think.
Yeah. I think that brings us to the next question. So lovely segue there, Dave, about how we're dealing with this. And just in the interest of time, I'm just going to open this up to the panel in general. And I think this is really a part of the follow-up to the last question. Are we dealing with this together? Are we seeing any slack being cut by the manufacturers and the service providers in terms of budgets and things like that. Because we all know that the two big costs for any SRL are staff and service. And so if we can try to manage to bring those down cooperatively with our stakeholders, which are of course our staff and our service providers, then that is potentially a way out of holes that we may have. So I'm just going to open that up to the panel.
Well, I can't talk about any bargains that I've been getting because I haven't been getting any, but if anyone's on the line from the companies and wants to give me one, I'm happy to take it. But what we have had is dealing with breakdowns remotely, and all of our service engineers for our Cytec Auroras are based in Australia, and they've been really good at sending us parts. We did have one breakdown. They sent us parts, tools, and a really prescriptive manual of how to fix it, and one of my staff was able to follow that, and we got that fixed. They've also been really good at giving us all the tools to do the job, and the moment that we got to alert level 2 BD, the guy from Auckland came down, because at least we've got a service engineer in New Zealand. He came down and did the PM and looked over our instruments. But I think that's always a problem for us, servicing in remote, you know, being so remote from the rest of the world. So we often, when we're buying instruments, we talk long and hard with companies about what they can do to support us to do it for ourselves. And I think it's been quite useful in this current environment.
Great. Okay. So it sounds like nobody else is going to give up any of their secrets.
Right. So, yeah, I could tell you, but I'd have to kill you afterwards. So let's say that some of the providers have been quite sympathetic. I've found, if you speak to them about if none of your instruments are in use, I've found there to be some sympathetic ears around.
Yeah. Yeah. Just an interesting comment here from Eric from the Garvin, who's saying that there looks to be group action on some of the companies in terms of less requirement for engineers and service contracts and things like that. So I don't understand that, but I think it's one that might come up and might be worth following up. All right. So with that,
on that, Rob, scientists tend to be a fairly quiet bunch. If you don't ask, you won't get. So I think it's worth just asking the question and see what response you get.
Time to make some noise.
Yeah.
Well, certainly, I think, you know, it's in everybody's best interest that nobody suffers unduly during this. And I think from what I've seen, people are wanting to work together. And so everybody's experiences are going to be different. Everybody's situation is going to be different. So I think that those conversations should be happening. So, all right. With that, we're just going to throw out and ask if there's any questions from the attendees. I see that quite a few people have found the Q&A window. So if there's any burning questions, put them in there now. Helen, do we have any that we missed during the conversation?
No, I think you've done a really good job of keeping up. We've been tapping away some direct responses as we go as well. Cool.
Yeah, thanks everyone for listening in and listening to us discuss things. Let's keep the conversation going. I actually have to go off in the finance point of view. I actually have to go off and have a discussion with our finance people right now about what some of the implications are going to be. So I'm going to sign off at this point. But I just want to say add my thanks to everybody for joining in. All
right. Thanks, Adrian. And if we don't see you again, we'll come and make sure that nothing untoward's happened to you. So, all right. If there's no other questions, there has not been any discussion about primary samples. Yeah, Jez. We did that on purpose because it wasn't, we figured that was actually a really big topic that in and of itself required another webinar. We, as ACS, the ACS, we believe that this is going to be potentially a monthly thing as we transition into a more normal work environment. So we would say that we are looking for panelists who can discuss things like biosafety sorting and the use of potentially COVID positive samples. And I think maybe everything is potentially COVID now if it's drawn recently. So I think those kind of questions, you can imagine they're going to be a really long conversation. So an hour in itself. So if you want to be part of that, please do hit us up at contact@cytometry.org.au. And if there's no other questions, I might just hand back to Helen.
Great.
And she can take us through this.
Thanks. Super quickly, we'll just run down some other ideas that we're floating around for this year that is by all means exceptional, that we can't meet in person, but if we can do these digital platforms, we can utilize them. We can keep, conversations going, having our cytometry community alive. So we've got this digital presence, this ACS Hour. If you like it, so far it seems to have worked. We've had some really great engagement today. We would like to keep it going, if not monthly, if not more, just on a regular basis. We'll take any topics that you're interested in. So if any ideas, just get in touch. And this year we've got our roadshow being a special edition of Home Show because we can't physically get together. Roadshow is really one of the main pieces on our calendar every year, and so we would like to keep it going. This year is no exception at all. We'll be building our utility for membership on the website, so that's something to watch this space. And the relationship we have with ISAC is very much being strengthened these days. We're promoting a concept of the ACS Hub in alignment with ISAC's virtual conferences this year plans. So we'll keep you informed of all of that. And, to finish off the year, of course, we have to have our AGM. And so we'll use a format somewhat like this to make sure we've got engagement and all of your input from the membership side. So we've got some great ideas. We'd love more. And if you'd like to get in touch and have a conversation, that's our email address. And we'll keep the Twitter conversation going today. And yeah, thanks, Rob.
Definitely. And definitely stay tuned for the next episode 2, which we believe will be around about this time next month.
Thanks, everyone.
Thank you, everyone.
All right,
Thanks,
thank you.
guys. See you later.
Thanks, guys.
Yeah.